Hi everybody, my name is Catherine and I'm here to present my speech today. My speech topic is on IVF or In Vitro Fertilization, and you might ask, what the heck is IVF? Well, I'm here to show you. IVF is a set of procedures that helps couples who cannot conceive naturally, conceive a child. So IVF takes mature eggs from the mother and sperm from the father, fertilizing them together in a petri dish and then inserting them back into the mother in hopes of conception. IVF actually means in glass. So it is saying in glass fertilization. That's where the words come from. And other ways of IVF are intrauterine insemination, intracytoplasmic sperm injection, or IVF using donor eggs. So what exactly causes IVF? Well, infertility in men and women is one of the main reasons that people use IVF. So issues such as endometriosis, premature ovarian failure, etc. can all cause difficulty in conceiving a child. And a statistic that I found is, according to Centers for Disease Control and Prevention, over 6.1 million women in the U.S. ages 15 through 44 have issues staying pregnant or getting pregnant for various reasons. And women over the age of 40 actually use IVF as a primary way in conceiving a child. So now we know what IVF is, let's talk about the procedure. The procedure can be done in multiple steps and takes many months to complete. The first step is ovulation induction, and this is where a woman is given medication or hormones for several months to stimulate her ovaries to produce multiple mature eggs for fertilization. The second step is egg retrieval. So after she has produced many mature eggs, a doctor will perform a procedure that gently takes these eggs from the follicle inside of her and then places it into a culture medium, waiting for them to be fertilized by the sperm. So the next step, of course, is sperm retrieval, pretty straightforward. Next is fertilization, and this could be done in two ways. The first way is insemination, and this is where the sperm is combined with the eggs in a petri dish and then left aside in hopes that the sperm will fertilize the eggs. The second way is intracytoplasmic sperm injection, or ICSI, and this is where a single healthy sperm will be injected inside each mature egg in hopes that this will cause fertilization and create an embryo. So the next is embryo transfer, and this is done 2 to 6 days after the egg retrieval, and this is where the doctor will insert a thin, flexible tube back into the mother's uterus and place the embryos fertilized based off of the two ways that I said above back inside of her. So a hormone medication called progesterone is used 8 to 10 days after the embryo transfer, and this pretty much just helps the embryos inside the uterus survive. And if successful, the embryos will attach to the lining of the uterus and start growing into a baby. So, like all procedures, there are risks. So there are many risks of IVF. The first risk is multiple births. So because you're placing many embryos back inside the mother's uterus, there's a chance to have multiple births or multiple children. So there's always a risk for this when using IVF. The second risk is miscarriage. So like women trying to conceive naturally, there's always a risk of IVF. There's always a risk of miscarriage, And with IVF, it is extremely high, and even higher when using frozen embryos. So a next risk is an ectopic pregnancy, and 2 to 5% of women who use IVF experience this, and this is where a fertilized egg implants itself into the fallopian tube instead of the uterus, and it is fatal. Finally, stress is a huge risk of IVF. IVF can cost between $12,000 to $17,000 and is a big stress both financially, physically, and emotionally on the parents and the child. So it is a big factor of IVF. So another reason why this topic is so important to me is because my mom used IVF and me and my siblings were a result of IVF. So because of IVF, me and my siblings were here today. So in conclusion, why does IVF matter? Well, it is the best and first choice for infertile couples, and babies can get a chance at life and mothers can get a chance at motherhood. A statistic that I found is the latest SERT done by the University of Pennsylvania Medicine found that over 61,740 babies born in 2012 were a result of IVF. And some future implications is that needle-free IVF is found as a new horizon for IVF, and it's where there's no blood shots, no blood work, etc., and it allows for the best eggs to be retrieved and fertilized in hopes of conceiving a child. And IVF shouldn't be something controversial, but rather be talked about and brought to people's attention, because IVF is a blessing and it helps so many parents have the gift of bringing life into this world, and it helps so many babies have a chance to be born each and every day. So with that, here are my citations, and I hope you enjoyed.